Hi everyone, my name is Dr. Adam Bonnington, and I am a gender-affirming surgeon in San Francisco, California. After vaginoplasty surgery, a lot of patients have questions about bowel movements, how to have one, what to expect, what is and is not normal. So here is some information that you will hopefully find helpful. At the end of your surgery, we put a whole bunch of packing material inside the vagina, and this puts a lot of pressure on the rectum. After surgery, the nerves down there are really confused, so sometimes this pressure can feel like needing to have a bowel movement. But for many patients, their first bowel movement isn't until many days after surgery, and in really rare cases, not until the packing comes out the following week. The most important thing to know for bowel movements after surgery is that we don't want you to push or strain or bear down or hold your breath. Ideally, you'll just relax your bottom muscles and things will flow out. It's common to see changes in the texture or color of your stool, or even a little bit of blood down there if it's dripping from the bottom of the dressing. Heavy, bright red bleeding from the anus would not be expected, and we would want to hear about that as soon as possible. You also may feel some popping during a bowel movement. This is normal postoperatively, and you have not damaged anything. Sometimes sitting on a normal toilet seat can be uncomfortable because those seats are designed to kind of pull the butt cheeks apart. So some patients find sitting on just one cheek is more comfortable, or even just picking up the seat altogether and sitting on the rim of the toilet. When you're finished going to the bathroom, we want you to be really gentle when cleaning up, and once the outside bandage is off, you will be instructed to spray the area with the dilute hydrogen peroxide solution and gently dab the area dry. Both constipation and diarrhea are really common after surgery. Constipation tends to be more uncomfortable and can lead to straining, which again we want to avoid. So you will be given stool softeners while in the hospital to prevent this. At home, we recommend daily Miralax for at least the first week and for as long as you are taking narcotic pain medication. You can also add once or twice a day Colace and things like Smooth Move tea or prune juice if the Miralax isn't enough. And drinking lots of water is also really important. On the flip side, some patients have diarrhea after surgery, sometimes because of the stool softeners and also the antibiotics you are receiving. And unfortunately, stooling accidents are also common. It's okay if stool stains the bottom of your dressing. There's no way for poop to get into your dressing or into the vagina. Overall, it's preferable to err on the side of a little diarrhea over constipation, but if you're having a lot of diarrhea, it's okay to take less of the stool softeners. If you've stopped all the stool softeners and still have uncontrollable frequent diarrhea, you can try a dose of Imodium, but please use this with caution as it can really back you up. There will be a lot of new sensations and experiences after vaginoplasty surgery, and having bowel movements is definitely one of them. I hope you found this helpful. Let us know if you have other questions, and please reach out if you'd like to make an appointment.